All right, we also want to say what's the scoop to our friends from Mālama Ola Health Services. I told you she was sitting right next to me. Daryle Ann Ho is the co-founder and director of clinical services. Welcome back.
Yes,
Thank you for having us.
and aloha also to Mike Ortiz. He's our LCSW social worker. How you doing, Mike?
Doing good. How are you?
Very, very
Mike,
good.
what does that mean, LCSW?
Licensed clinical social worker.
Got it.
Ooh.
Yeah,
You
that's
get the credentials.
that's big credentials. And
Heavy credentials.
Yeah.
yes, and important credentials, especially for this particular talk story session with you, yeah,
Yes.
Daryle Ann. Now, please explain to us why social work is such a critical part of the work that you folks do in hospice and palliative care.
So, Mālama Ola, locally organized and rooted in Hawaii, we're an end-of-life organization. And, not only do our medical team, our medical team goes out, to take care of our families, and that's what everybody thinks. They go out and they take care of the patients. But a big integral part of that team is our social workers. They are the ones that come and guide the families and have, some hard discussions with them,
Yeah.
and actually really make them feel like, okay, this is doable.
We can get through
we
this.
can get through this. We can, we can make things happen. Yes, we have, a critical illness, or, Papa has a critical illness, but they're like the beacon, the shining light, to help them through this.
Wow.
And
Very important.
Very important. And our social work team is amazing. And this month is Social Work Month, so we really appreciate our social workers, and wanted to shine light on their
The good work
program.
they do.
Exactly.
For sure.
Well, very
Exactly.
cool. Well, let's do a little deeper dive, Mike, if you can. Just kind of share with us how hospice social workers support the families beyond the medical care.
It's a good question. So, because it's such a difficult and trying time for our families, we really want to focus in on supporting them emotionally and with compassion. So we really want to help these families to not just focus on the end of life, but focus on the life. And so we want to really help them to remember, the good times, cherish the time that they have, and really help to focus in on supporting them, and whether it is connecting with a loved one, whether it's respecting their cultural, spiritual, religious traditions. We want to make sure that we can highlight that and make this time as special as we can.
Wow.
That's beautiful, brother. I mean, and we've both been in situations where we've had family members that were in hospice, and I understand that is an important part. Sometimes you're so focused on the medical support that it's this emotional support that I think that is very powerful. But Mike, just asking you personally, as a social worker, you could work in any field in social work and working with people at all different stages of their lives. Why is hospice and palliative care social work so meaningful to you?
It's a good question. So I think to start, it's in our name, Mālama, right? That's the value that really helps to guide us.
Yep.
And we understand that this work is a very deeply personal experience for families, and this work is very personal to me. I watched both my grandparents take their last breaths, and we had the support of our hospice team, and just going through that experience really helped me to see how important it was to have that team by our side. And so those experiences really helped to nudge me into hospice work.
Well,
Beautiful.
Thank you so much for taking that, which could be, painful experiences, and learning from that, and then helping your guys' patients kind of cope with the same experience that they're going through. That's so great. Thank you so much.
And possibly bringing them joy and good memories at the end of life of somebody that they love.
Yep,
We
that's our
love
goal.
that. We love that. If there's any of our viewers are watching right now and they want to be able to reach out to you folks at Mālama Ola, how can they do that, Daryle?
They can call us, our main number. They can reach us on the web, or just have a family reach out to us, or doctors. They can call us anytime.
You guys are available, yeah?
24/7.
You guys are available.
24/7.
That's why I think you guys were voted best of the best, yeah? Last year. So hopefully
Thank
for this
you.
year too. But thank you guys so
Yes,
much
thank you
for
so
coming
much.
back.
Oh yes, absolutely, and it's in the name, Mālama Ola. We love it.
Thank you so
much. Daryle Ann Ho, Mike Ortiz, we appreciate you folks. Mālama Ola Health Services.